Hello, welcome to sonography-radiology training channel. In this video series, a case with one teaching point is presented. This is the 7th video in this video series about a scalp lesion. A 67-year-old woman who presented with a superficially palpable mass of the scalp on the right frontal region referred to us by a dermatologist for scalp ultrasound. She had no any other symptom. The question was, what is the properties of the mass, cystic or solid? It's possible to remove the mass with microsurgery in a dermatology clinic. In this ultrasound clip that we take from the scalp surface, we found an ill-defined heterogeneous hypoechoic mass-like lesion in the subgaleal lesions that cause mass effect and erosion on the diploic layer of the skull. For better view, you can see schematic image of the scalp layers, and this is the lesion that we found in ultrasound. Here is the epidermal layer of the skin. Here is subcutaneous fat layer. Here you can see galea and subpneurotic connective tissue. Here the lesion that we found, the diploic layer of the skull and the dura mater. In this color Doppler ultrasound clip, we found that the lesion is very hypervascular, that has arterial and venous vessels and seems to be supplied from the meningeal arteries of the dural surface and drainage to the superior sagittal sinus. With this image, in first probability, we think that we encountered with a subgaleal atriovenous malformation like this image, which supplies from the meningeal artery of the dural surface and drainage to the superior sagittal sinus. The patient had no any other request, but we decided to take a skull X-ray, and after taking the skull X-ray, we surprised with these images. As you can see, we found many lytic metastatic lesions on the skull surface, and really this vascular region that we found in ultrasound is one of these lytic metastatic lesions that erodes the skull surface and connects to the meningeal arteries of the dural surface and drainage to the superior sagittal sinus. And finally, the teaching point that we can take from this case is that sometimes palpable scalp lesions in seemingly healthy people may be the tip of the iceberg that leads us to much more important things like metastasis. Thank you for your attention.